I'm a little choked on time, but I asked Dr. Patrick Soon-Shiong to come on because he told me he's helping the government with what's happening with the Ebola virus. And I wanted to just ask him a couple of quick questions about what's happening with that and what's happening with his drug, Anktiva, and the FDA, and whether or not there's any chance that more people can get more access to it soon. Dr. Pat, good to see you. First, Ebola.
Good to see you, Chris.
Do we have to worry here?
Well, I think something we don't know enough about at this point. But I must tell you what I've been doing. So I've been asked by the Africa CDC and Dr. Jean Kaseya to get involved, and we're doing sort of daily calls, and we had a very deep call this morning. And one of the concerns I have is there's a doctor in Washington State University. His name is Dr. Njenga, and what he has shown is that once the patients get Ebola infection, the latency and persistence can continue for hundreds of days. Now, that is a real concern, both in the breast milk and the semen. Mm-hmm. And so the question is, with a 21-day incubation period, how do we get concerned about that? There's a lot of unknowns. But having said that, the Africa CDC, both in Sudan, Uganda, and Congo, I must say, are taking a very proactive stance of trying to not be non-active about this, but trying to actually treat patients who are very, very ill. And that's what we're getting involved with. And there's a universal truth, sadly. These patients have the immune system collapsed. They have no NK cells, no T cells. And that's why we were called in. Because there's another universal truth that I've sent you some papers, that IL-15 can now stimulate these NK and T cells. So that's what we're going to try and attempt to do. It's obviously never been tested. We do understand that this is something that we need to just try and help where we can.
So I just want to keep people aware of you. I said to Pat the other day, I don't know how you do it. I have so many people coming to me, my daughter, my son, my wife, my mother, me, I have this cancer, nothing's working. Can you help me with Dr. Pat? I don't know how you do it. Is the FDA giving any indication that Anktiva is any closer? Oh, wait, hold on. I'll take a commercial. I'm going to give you the time on the other side of the break, and you'll answer that question. Dr. Pat Soon-Shiong will be right back with me right after this. Dr. Pat, my boss is watching, and he said, hey, let Dr. Pat answer this question. He matters. So what should people know about the fight to get Anktiva for more people who are dealing with severe cancers?
So let's talk about the bladder cancer, the BCG unresponsive bladder cancer, for which it's approved for cysts plus or minus papillary. The good news is they had a workshop, the FDA had a workshop to find out from the thought leaders, is cysts and papillary the same disease in terms of how they treat it? And the outcome of that workshop is the doctors all said that's how they treat it. If they see papillary disease, they move on as if it was papillary plus cysts. And the data is now sitting in the hands of the FDA, our filing. There's now new leadership in the FDA. And I can only remain hopeful of them now reviewing the data and together with that workshop. The other thing that we have talking to the FDA about is a 14-year BCG shortage. We think we've resolved that. There is a strain that they've completed a randomized trial, and we'll be talking to the FDA about that. With regard to the other cancers, Chris, you know exactly how people are still desperately calling, and I'm working as hard as I can to get there.
Well, Dr. Pat, I've never seen anything like it. And I appreciate knowing you, and I appreciate getting to chronicle this journey, and I will stay on it. Dr. Patrick Soon-Shiong, thank you for how you're helping with Ebola and, of course, with cancer. We're here for it.
Thank you. Thank you for having me.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.